The school-aged years, sometimes referred to as middle childhood, is a period of growth and change in the physical, cognitive, emotional, social, and moral development of the child. This is a time of growing independence, greater reliance on peers, and a clearer sense of self-identity. The physical examination of the school-aged child proceeds in a methodical fashion, much like the physical examination of the adult. This aged child is usually calm and cooperative for the clinician. Start the exam by introducing yourself and provide clear explanations on what you will be doing as you move through the exam. Physically, during the middle childhood years, the physical growth rate slows, but clear improvements in strength and motor coordination occur. These changes are behind the child's sense of confidence in physical abilities and is the time when many children begin to participate in team sports, dance, gymnastics, or other physical pursuits. Cognitively, as the child moves through these years, there is increased complexity and creativity in written and verbal communication. He or she matures in his ability to understand the world and those around him. School success is most likely to occur when school achievement is valued by the family and there is a clear message given by parents on the value of school success. Changes occur in the social and emotional arena as well. For the increased independence of this age comes development of their own sense of personhood, who they are and how they fit in their family, in their school class, their neighborhood, and their community. The challenge to parents of middle-aged children is to allow them greater independence, but maintain the structure of expectations and guidelines they can understand and accept. Along with the child's development of a sense of self comes growth in moral and spiritual aspects of their personality. There is a beginning understanding of the life cycle: birth, growth, aging, and death. Children of this age can start to understand that they are part of a larger societal whole. Again, the family and community are instrumental in setting examples of basic moral principles and values. As the clinician, you can assess how the child is developing in each of these areas through questions you ask of both the child and parent during the exam. For example, for the younger middle-aged child, you can ask the parent about school attendance. Or when your child plays with other children, does she keep up with them? Is your child proud of his school achievements? What are the rules at home for TV watching, homework time, etc.? For the older school-age child, you can ask, what kind of activities are you involved in at school and after school? Are you concerned about your weight? Are you trying to change it? Do your friends pressure you to do things you don't want to do? One thing to keep in mind with a school-age child is that many times learning problems may not become evident until the later elementary school years as classroom demands and expectations for school performance increase. The first step in assessing a child who has had a change in school performance is to rule out visual problems and hearing acuity changes. Along with a routine otoscopic exam, an audiometry test may also be necessary. With further development of the eustachian tube and improved immunologic response, the frequency of ear infections declines for many school-age children. With the oral examination, pay special attention to any evidence of caries, developmental anomalies, malocclusion, or dental injuries. Encourage the child to brush their teeth twice a day with fluoridated toothpaste and floss daily. Dental appointments should be scheduled every 6 months. With this particular child, malocclusion is present, and referral to a specialist is indicated. As you continue the exam, pay particular respect to the child's privacy by using appropriate draping during the examination. Palpate the anterior chest for the apical impulse, cardiac thrills, and any abnormal pulsations. The apical impulse is usually easily felt in children of normal weight. Children and adolescents frequently have an innocent systolic murmur called a flow murmur, best heard in the second and fourth left intercostal space. However, any systolic murmur, grade 3 or more, needs to have pathology ruled out prior to classifying it as an innocent murmur. When auscultating the chest, fluctuations in the rate and rhythm of the apical impulse in conjunction with respiration is commonly heard. This condition is called sinus arrhythmia and is considered benign in children in the absence of any other cardiac abnormality. Along with performing the chest assessment, determine if there has been any developmental changes of the breast in the female child. If changes have started, determine the Tanner stage of breast development appropriate for the patient. This would also be an opportune time to provide anticipatory guidance on puberty and sexual development. You can ask the child if they have had a family life education course at school which covers the topics of puberty and body changes. Ask the parent if they have prepared their daughter for menstruation. For boys, ask the parent if they have prepared their son for wet dreams. Provide additional information to both the child and parent as determined by their responses to your questions. The medical history should include questions related to respiratory illness or previous respiratory infections such as asthma, bronchitis, or pneumonia. Family history of respiratory problems is also important. Ask about exposure to pollutants in the air, including exposure to secondhand smoke. This is a good time to discuss issues of self-care, such as discouraging smoking and drug use. Health teaching, such as prevention of respiratory illnesses through hand washing and covering of the mouth while coughing or sneezing, can also be discussed. Allowing children to listen to their own lung sounds and heart sounds and a brief explanation of how these function is helpful in patient education. You may have a drawing that you use in the clinic that children can look at while they're having their examination, or you may even draw these body parts for them with brief explanations. Auscultate the heart in the supine position as well as the sitting position and document the heart sounds. Explain to the child what you are doing as you continue the examination. Again, note the draping and protecting the child's privacy. Good eating habits should be encouraged. During the history, obtain information about the typical day's diet. You may want to obtain a 24-hour dietary recall. Discuss snacks and options for healthy snacks. Many children go to school without breakfast. This is an opportunity to discuss the importance of breakfast and family meals. Bending the legs helps relax the abdomen. Again, note the draping and appropriate exposure of the abdomen. Percussion. Palpation. Be sure to ask about any areas of tenderness. Palpate the liver, asking the patient to take a deep breath and feel the liver as it extends to your fingers. Palpate the spleen in the upper left quadrant, and palpate the kidneys. This is an appropriate time to examine the genitalia. Explain what you will be doing. You can discuss with the parent in advance that you will be examining the genitalia. It is a good time to discuss inappropriate touch and what the child would do in such a circumstance. The parent should be present during all parts of the physical examination for this age child. Remember to palpate the femoral pulses and check for inguinal nodes. Again, explain to the child what you are doing. The musculoskeletal examination can be focused around the physical activities in which the child participates. Check for any swelling or pain, range of motion, and stability of joints. Exercise should be encouraged. Discuss appropriate athletic safety precautions, including the use of helmets for certain sports, as well as bicycle riding. Inspect the skin of the legs and feet. Fungal infections and lesions related to poor fitting shoes can occur. Reflexes are examined in the same manner as the adult exam. Patellar, Achilles, and Babinski. Remember to compare one side to the other. Upper body reflexes, biceps, brachioradialis, and triceps. Note the cooperation of this age child. Further neurologic testing can be done with the finger to thumb test and the rapid alternating hand movement, testing fine motor coordination. In the finger to nose to examiner's finger, observe for tremor or past pointing. Note the difference between this age child and the child examined in the previous segment. The cranial nerves can be evaluated in the same manner as the adult exam. Can you name the cranial nerves that are being tested by this examiner? The examination for scoliosis. The child should be barefoot and unclothed from the waist up. Explain to the child what you are doing. Stand in back of the child to better visualize the bony landmarks. Observe the shoulder and hip heights, assessing equality. Have the child bend to the floor with the arms together. With your eyes at the level of the scapula, observe for any abnormal rise. Both scapula should be at the same level. Scoliosis is a family trait and more common in girls. Treatment is dependent on the severity, and a referral to an orthopedist should be made if there is lateral curvature. California Children's Service may be contacted for assistance. The neuromuscular exam can be completed by testing gait and balance. Be alert to the signs and symptoms of childhood depression. The child may feel sad, angry, or perhaps exhibit anxiety or a loss of energy. Depressed children often have somatic complaints. Depression will be further discussed in the primary care course. At the end of the examination, summarize your findings with the parent and child. Acknowledge both the parent and child for appropriate healthy activities. Commend the parent on their concern and care of the child and provide health education materials as indicated by their concerns as well as yours. Make appropriate medical and community referrals as needed and explain to parents verbally and in writing.